Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 76 of the Ask Dr. Angela podcast. So I was seeing a patient the other day, young lady, 35, and she said to me, Dr. Angela, aren't you going to order a baseline mammogram on me? And I'm like, why? And she said, because my girlfriend got one. Now, just because your girlfriend got one doesn't necessarily mean that it's the right thing to do. And what's really interesting to me is that people are still ordering baseline mammograms, specifically with all of these guidelines that are coming out, specifically since the guidelines are moving in the opposite direction, which is starting mammograms at the age of 45 per the American Cancer Society. So this is the deal with baseline mammograms. Nobody does that anymore, except for maybe primary care physicians or some other folks that don't specialize in women's health. But really, you do not need a baseline mammogram so that they have films to compare to when you start getting your regular mammograms at 40 or 45, depending on whose guidelines you're following. So just to kind of quelch that one, no, you do not need a baseline mammogram. The only way that I'm ordering a mammogram on someone that is 35 is going to be, number one, if we feel a palpable mass. Number two, if there's a history of a first-degree relative, i.e. a mom, that was diagnosed with breast cancer at 45, because the rule there is that you should start screening mammography 10 years prior to the age of the diagnosis of that first-degree relative. So again, if you have a mom that was diagnosed at 45, of course, we would start screening mammography at the age of 35. But, baseline mammograms are so old school. I think that when I initially got out of residency, which was back in 2005, my first couple years of practice, I think that maybe either that was the recommendation or we were just doing them. But that's just not what we're doing these days. I hope that this clears that up for a lot of people out there that are wondering, do I need a baseline mammogram? The answer to that is no. But just quickly touching on the guidelines, and I know that we've done podcasts on breast cancer screening, et cetera, so I'm not going to beat that dead horse. But, per ACOG guidelines, that's the American College of OBGYN, screening mammography starts at the age of 40. Per the American Cancer Society, they've pushed that back to 45. I still follow ACOG guidelines because we did not change our guidelines or endorse the American Cancer Society's recommendations. So I'm an OBGYN, I follow ACOG guidelines. I hope that this has clarified a thing or two for those of you out there that had this question, because a lot of people have this question. So hopefully this helps. Thank you so much for tuning into the Ask Dr. Angela podcast. We are really kicking ass over here. I'm just so excited with everything that we're doing. People are really supporting, reaching out, and utilizing this resource to access, information on women's health, which has been amazing. I know I've been saying amazing a lot, but a lot of really amazing things are happening as a result of this podcast. So if there's a question that you want addressed, if you have a topic that you want to hear about, submit it. Go to www.askdrangela.com, AskDrangela. Click on the microphone on the right-hand side of the page and do what you do. Rock the mic. If we do happen to use your question, we'll send you one of our bomb-ass t-shirts. In closing, I'd like to leave you with this. John C. Maxwell said, "People may hear your words, but they feel your attitude." So remember, when you speak, people don't just listen to the words, but also your passion and determination. As a matter of fact, that's probably what is most evident. Thank you so much for tuning into the Ask Dr. Angela podcast. It's always a pleasure. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 77.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.